Hi, my name is Shane and I'm the respiratory care practitioner with Rocky Mountain Respiratory Resource. I've been a respiratory practitioner for the last 35 years. What I'd like to talk to you about today is COVID-19, how to identify, how to treat, how to manage those patients, and what to expect. The first thing is we want to know it came out of Wuhan, China. It's killed about 3,800 people in the United States so far. Keep in mind our flu has killed about 38,000 in the United States already this year. There has been 38,000 who have died from viral pneumonia with this virus in the entire world. So our flu in the United States has killed as many as this virus has in the entire country, in the entire world, in fact. So to identify, we're going to be looking for high fevers initially. We're going to be looking for dehydration, big decreases in blood pressure, big increases in heart rate, the signs and the symptoms. But the big thing is that fever. Once we see that fever, we're going to go ahead and give them a test to see if they're positive or they're negative, and we will begin to be supportive from a respiratory standpoint with whatever they need. Hopefully it's just a little bit of oxygen, which sometimes when their fever rises so quickly, we have a shift in 2,3-DPG, and we have a big decrease in oxygen and an increase in the consumption with high fever. So we want to watch those oxygen levels. We're going to be supportive. We're not going to nebulize. I know you're going to see articles across the country where hospitals are nebulizing. Our feeling is we don't want to nebulize it. We do not want to aerosolize it and increase transmissions by putting it into the air, and that's exactly what that does. The other thing is that patients that come in with obstructive sleep apnea or central sleep apnea that are using CPAPs and BiPAPs, we're going to put them on hold temporarily so that we're not increasing transmissions by putting that into the air for others to breathe. Now, if they're using CPAP or BiPAP in a situation where it's a life-sustaining, almost like a ventilator, then we're going to let them go ahead and do it, but we will put a bacterial filter on the expiratory port to prevent that from becoming aerosolized into the air and increasing transmissions. What we will also do, if they have other underlying symptoms like wheezing, increase in mucus, we are going to treat that respiratory issue, but we'll use inhalers with aero chambers. Any inhaler that can be chambered, we're going to chamber. We'll also use DPIs. These will be most effective in the treatment of this without increasing the transmission. Now, as the fever rises, the oxygen consumption really increases, and these people start to get into respiratory failure, we will intubate without using an ambu bag if possible, and we will put them on mechanical ventilation, and we will support them until we're able to extubate, to remove the endotracheal tube, and then get them back onto a nasal cannula, and then treat the signs and the symptoms as we go forward. So I don't think that this is going to be something that is going to take over and create a massive crash in our healthcare system, as everybody is thinking that it will. But it might. We just need to be prepared for it. You guys can always reach out to us through our website at any time if you have any questions, suggestions, or ideas. I want to thank you so very much for taking the time to watch this video with us today. Take care.